My name is Holly Edwards, and this is my theatre video presentation of setting up and checking our anaesthetic machines. We have 2 anaesthetic machines in our hospital, one in our treatment room and one in our theatre. So I'll go through with you both of them because they are a little bit different. So I'll show you how I fill up the vaporizer, change over the breathing systems on both of them as well. So on both of our machines we have 2 types of breathing circuits. We have a non-rebreathing and a breathing circuit. So for our one in our treatment room, our T-piece looks like this. So this is our non-rebreathing. Basically non-rebreathing is that because it is only one tube, one side that is connected into the animal's ET tube, and then the other side that flushes through the ISO. So this is our anaesthetic machine that is in our treatment room. So you can see the vaporizer chamber here. It is currently nearly on empty, so I will be showing you how to fill that up. Connected at the moment is our rebreathing system. So we obviously have the 2 tubes going in the inhalation and exhalation valves. So this is obviously our rebreathing, and then this end here connects to the animal. So when we are swapping over from the rebreathing to the non-rebreathing circuits, we do have to disconnect them. So down at the bottom here is our little attachment here. So when we're taking off from the rebreathing system, we just pull these 2 tubes apart, and then we connect the non-rebreathing to this part here. So the end of the non-rebreathing, and it gets connected like that. And then our T-piece is ready to be used. To the non-rebreathing circuit, we also need to make sure that our waste compartment is attached. So at the end here, we make sure that the valve is open, so the bag is able to let in and out air, and then we connect it to the waste system, which then flows out of the hospital. Okay, so before we use any or either of our anaesthetic machines, we always need to be leak testing both of the systems. Obviously, if we have a sterile procedure, we'll be moving them from the treatment room to the surgical theatre, so we need to make sure that both lines, both breathing systems and the bag that we're going to be used has no leaks in it. So to do that, okay, so I'll grab the rebreathing system. Now we have a 1 litre bag attached here behind this little dial. So I'm going to close that off, make sure that my bag is secure, and I'm going to turn the oxygen on to high, obviously. Wait for it to fill up. You can see it starting to fill up there. So that's pretty much at the maximum. So I'll turn the oxygen off, and as you can see, the bag isn't deflating at all. So I've got this end secure, the pop-off valve is closed, so nothing is releasing into the waste system, and the bag is still inflated. So that is how I would check for a leak test. So if I do take my finger off this, the bag is going to go down and release what's inside of it. So another check that I like to do every morning before we're putting any of our animals under anaesthetic is checking the last time that the soda lime had been replaced. Within about a week to a fortnight in some cases, we do replace it that often. Also checking the colour, so I want to make sure that it is not discolouring at any point. Our soda lime goes from white to purple. So this is our soda lime chamber here connected to our ISO machine. So as you can see, all of the soda limes haven't discoloured yet, and it was only replaced a couple of days ago by myself, so I know that it is fresh and ready to go. So if I was to find a leak in one of our breathing systems, the first thing that I would do is make sure that everything is connected properly. Sometimes it's just the smallest thing that hasn't been connected properly is that we need to actually find and do. So I would always make sure that the connection from the rebreathing system or the breathing circuit, to the actual machine is connected properly. So I would always double check that. I'd always make sure that the pop-off valve is actually opened and it is releasing air. Always make sure that there is a bag attached. In that case, I would have a look over the breathing bag, make sure I can't see any holes. Or any possible ways for it to be leaking. So after you perform a leak test, it is always very, very vital that you do open up the pop-off valve again, because it can be very detrimental to the patient's lungs. So once you have performed your leak test and everything is fine and working correctly, you do need to release that back open. So that is this top one here. So it was down, so I've just turned it back open again so that the waste will run out and then that patient will be able to breathe in and out properly. So this is our ISO machine in our surgical theatre. So this is our vaporizer chamber and this is where the soda lime is. So again, this was only just recently replaced by myself, so I do know that it is updated and that it doesn't need to be changed. This is our rebreathing circuit already attached at the moment, and our non-rebreathing circuit is here. To change over from our rebreathing circuit to our non-rebreathing circuit, it is really easy with this machine. So all we need to do here is pull this out here. This is our rebreathing circuit system. That gets pulled out and it's just left there to dangle. And then our T-piece just gets connected straight in there. So it's already got a ½ litre bag already attached to it. This is the waste tubing, so that gets filtered over there and then gets put into the waste chamber. And then this tubing here goes into the animal. So that sits up on the bed like that, and that is ready to go. The pop-off valve is up here. It has a little nozzle here to tell you which way is open and closed. So obviously you just leave it on opened. So that's how we switch over to each rebreathing circuit on our. Okay, so this is our vaporizer here. So there is the level, so you can see this one also is nearly empty from today, so I will be filling that one up in preparation for tomorrow. So this little side bit here, we release all the way out. Now in terms of the extension, these two holes don't point downwards like in our treatment room, they actually point to the side like this. So I fit this into the machine like so, secure this in place by tightening that. Now, in terms of this one filling up, we actually do release this here. Once this is all secure and tight, we actually do release the valve here, and then we start tipping the isoflurane in. Once that is full, we then tighten that seal back, undo this, and pull it out.